We're in the first week of the new presidential administration, and that means you're probably hearing a lot about executive orders. Let's get into what executive orders really are, which ones we're worried about, and what can be done to counteract them. First off, what is an executive order? An executive order is a published directive from the president that provides instructions to the executive branch about how to run their operations. In other words, it's the president telling the parts of the government under his supervision, things like the Department of Education and the Department of the Interior, what his priorities are and what goals he wants them to pursue. An executive order is not legislation, and it cannot create new laws or contradict existing laws. Only Congress can do that. It's meant to tell federal agencies how he wants them to implement existing laws. For example, an executive order could not declare that gender-affirming care is illegal at a federal level, but it could tell the Department of Health and Human Services to remove Medicaid's coverage for gender-affirming care, making it much harder to access. This means that executive orders can have a lot of power in dictating things that are already law and whose implementation guidelines were left ambiguous.
But relatively little power in things where legislation provides detailed implementation plans.
When could a new executive order affect us? First-day executive orders are meant to be a grand show of priorities. They're meant to define the goals of the administration, not immediately enact them. The amount of time it takes to implement them can be very lengthy because they have to go through a multi-step review process, especially when they require the creation of new rules and regulations. As an example, let's look at an executive order from the Biden administration. Former President Biden signed Executive Order 14117 in February 2024, which focused on changing data security practices for federal agencies. It's pretty unoffensive, pretty simple. It took several months for an implementation proposal to be put together, and that proposal was open to public comment starting in late October. Public comment took about a month, then another month to finalize the implementation, and it finally went into effect about 2 weeks ago. So that means that even a relatively mundane executive order took nearly a year to actually implement. The Trump administration put out 47 first-day executive orders on Monday, the vast majority of which are very controversial and address very complex systems. That means, for the most part, their goals will not get done quickly. They know that, but they want to make it seem like everything is getting done on day one. So what executive orders do we think will affect access to equitable healthcare?
Some of these executive orders seek to redefine gender and sex as exclusively male or female among federal agencies. One of the main goals is to prohibit federal funds from being used for gender-affirming care, or as this administration is calling it, promote gender ideology. Federally qualified healthcare centers like Howard Brown that provide gender-affirming care, even paperwork or signage in clinics that respect a person's gender identity, might be considered out of step with these proposed federal guidelines. These executive orders are also rescinding numerous supportive and LGBTQ+ inclusive guidance materials produced by various federal agencies. One executive order calls for potentially removing federal funding from organizations that provide healthcare services to undocumented immigrants, making it harder for that community to get the care that they need. This administration is also looking to rescind several healthcare executive orders enacted under the Biden administration that help to increase access to health insurance and provide lower drug costs for those utilizing Medicaid and Medicare.
So how do we combat these executive orders and any new ones that come down the line?
At an organizational level, advocates like Howard Brown Health and Equality Illinois are already organizing to analyze and respond to these executive orders. We have a lot of tools at our disposal. We can use the required public comment periods to complicate and delay implementation. We can work with organizations like Lambda Legal and ACLU to challenge the executive orders in court, and we can work with our congressional leaders to pass new laws that would supersede the executive orders and make them impossible to enact. Our community of advocates is monitoring the executive branch closely, and we are prepared to use every resource legally available to us to ensure that our patients, our staff, and our communities are safe.
As an individual, here's what you can do. 1. Double check your facts and don't comply in advance. There's a lot of misinformation about what these orders are and when they go into effect. It's in the interest of the current administration that you assume these things are final and unchangeable. They're not. So before coming to any conclusions, check the story against multiple reliable sources first. Talk with trusted advisors before making any big decisions because of an executive order. 2. Know your rights. No matter what happens, you have rights. Especially for our immigrant neighbors, friends, and family, please make sure you know your rights and share that info with others. Check the description for an excellent resource from our friends at the Illinois Coalition for Immigrant and Refugee Rights. 3. Raise your voice in dissent. Help us make sure our voices aren't drowned out by anti-LGBTQ+, anti-community health rhetoric. Stay in touch with our advocacy team through our newsletter or follow another organization that serves your community. We'll make sure you know when there are opportunities to make your dissent heard loud and clear.